It's now with great pleasure to introduce briefly the CCI4EU, the Cancer Mission Project entitled Comprehensive Cancer Infrastructures for Europe, that it proposes a tailored capacity building program to achieve that 90% of cancer patients are treated in comprehensive cancer infrastructures by 2030. It has started its operation in May 23, and with a total indicative budget of 10 million euro. The coordinator organization is OECI, Organization of European Cancer Institutes, and the main contact person is Professor Giovani Apolone from National Cancer Institute in Italy. And I have the pleasure to invite him on the stage alongside with Ms. Olga Balaura, CEO of IRCCS Hospital. So thank you very much. We're very eager to hear presenting your work in CCI4EU and talk about it. Thank you.
Thank you very much for the invitation and the opportunity to share with you what we have planned to do and what we have done in the context of this project. Well, my presentation is organized in three major structures. I will spend just one slide to remind to all of us the very complex scenario when we are talking about cancer organization, cancer outcome in Europe. I will remind us something about the cancer mission, because the CCI4EU is the result of one of the first 13 calls of the cancer mission. I will introduce with an overview, of course, also the project and the current status. So we know that cancer is a major problem in all our 27 plus affiliated countries in Europe. The incidence will increase given the fact that we are not able to control the most important risk factors, and because of the aging of the population. And the very important point is that there is a very huge and unacceptable variability in epidemiology, in amount of money allocated to cancer care, in healthcare organization, and too bad also in outcome between countries, but also within countries. That is the very important fact that should be taken in mind when we will be able to implement some changes. So we are not a problem of a difference between countries, but at least in some big countries, there is also a quite huge unacceptable variability in terms of epidemiology, quality of care, and outcome. Europe Beating Cancer Plan and Cancer Mission have more or less complementary objectives: to increase knowledge by research, to improve quality of care with a lot of initiatives. Some of them are presented in this section, and by identification and fighting unacceptable and actionable variability. If I well remember, in September 2020, it was published this booklet in which, after a background, a rationale, the reason why we have to focus on cancer, there well a part of the document in which there is a list of 13 recommendations that has been translated in 13 bold action, and of course, at the very end, in competitive calls. These are the 13 recommendations for bold action, and one of these, this one, is about the call that we will see together in the next slides, that at the very end produced our proposal regarding the comprehensive cancer infrastructure. This is some basic information about the call. You can see that the call for a research and innovation-centered capacity building program in order to create the basis for improving the quality of care and increasing the number of patients treated in the context of high quality of care center infrastructure network. What about the definition of infrastructure? Because you have had the chance to see a lot of words about different tools that we are developing in the context of the different projects and cancer mission. We talked about hubs, comprehensive cancer center, comprehensive cancer infrastructure, network of expertise. The definition of the mission board about what are talking about when you use the term comprehensive cancer infrastructure is a national or regional infrastructure, not center, non-institute, that provide resources and service to support, improve, integrate cancer care, research, training, and so on. This is a very important point because from the formal point of view, an infrastructure is something different from a comprehensive cancer institute or comprehensive cancer center. Because it has the intrinsic meaning of doing the best to treat patients, also to furnish, to produce a service to someone else. So an infrastructure in general should be seen as a sort of hub and spoke infrastructure, in which maybe the backbone are comprehensive cancer center with some kind of European accreditation, but we need also some spoke around this backbone of comprehensive cancer center in order to be able to recruit as many as possible patients, because the target is 90%. With the survey carried out at the beginning of the cancer mission in Europe, it was estimated that across Europe, the number of people with cancer treated in something that could be defined as a comprehensive cancer center infrastructure vary from 0% to 40%. Our project is as objective to strengthen the research capacity of comprehensive cancer infrastructure. Is coordinated by OCI, and we involve 27 member states plus 4 associated countries. Altogether are more than 50 different legal entities. It's supposed to last 3 years, and the budget is about 90 million. 9 million, sorry, 90 maybe in the future. The most important steps of this project is to develop a theoretical model of infrastructure. We are here, all the project we are talking about, the hub, the comprehensive cancer center, comprehensive cancer infrastructure, network of expertise. The first step is define what we are talking about. And so what we are talking about is the first step of our project. Then we are going to map all the different participating countries in order to assess the maturity level in terms of capability to have a comprehensive cancer infrastructure. Then we have designed and we are going to implement a capacity building program in order to prepare the ground for the later on implementation of what produced. The project is organized in 8 working packages, and the hub intervention is the capacity building program. Capacity building is defined as a complex intervention that requires multiple action delivered to policymakers, researchers, professionals, citizens, patients, caregivers, and also private company. And it's a complex of different individual intervention that has objective to prepare the ground for the implementation of the infrastructure. So we are talking about different steps. The first one I am going to conclude is to define quality indicator and the maturity model. Then to profile each member state in order to understand the level of maturity when talking about a comprehensive cancer infrastructure. Then we have to design a tailored intervention according to each member state's level of maturity. And then, of course, we will deliver it. And at the very end, we will try to disseminate and to exploit the results. 3 days ago, we had a General Assembly in Milano in which 100 people working in the context of the project met. And here you can see here the list of working packages and the different tasks and the Gantt. So more or less, we are on schedule. And I remember you that this project started just 14 months ago. So thank you very much for your attention.